So imagine cavities, but no need for dental drills or being numbed up.
There is a dentist who is the first in Houston to make that dream a reality. Domely Keith is live at his office near Cypress. Good morning, Domely. I cannot wait to hear what you have to say and what you have to show us.
Yeah, good morning, Melissa. No more drills at this dentist office. They've all been thrown away, and this is Innovative Smiles out on Highway 6. Dr. Wender, Dr. Jerry Wender, you know, I hate to break it to you, but people don't like to come to see you.
I know. It's a very common problem.
But now we can all enjoy coming to see the dentist again because the drills have been thrown out, and you now use what?
I use a laser. This is the first FDA-approved laser for hard and soft tissue. So you can do fillings, you can work on the soft tissue without giving the patient a shot. So that removes a lot of the fear and anxiety from patients of doing fillings.
So this laser now replaces the drills?
It replaces the drill. Now you still have to use the drill a little bit at the end to polish the filling, but that's about it.
And no more shots to numb the area?
We're not exactly sure why, except that the pulse duration, the pulsing of the laser numbs the tooth.
And it's painless?
Ask her.
All right, I will. 12-year-old Sydney had the procedure done just a couple months ago, and Sydney does not like shots. She had open heart surgery a few years ago. She's had lots of trips to the doctor's office, and you're not real fond of seeing the doctor or the dentist. Tell me how the procedure went for you.
It was very easy, and there was no shots, no numbness. It was just cold. That's all you felt.
Really? So you were really dreading having your teeth filled and having the cavities taken out?
Yes, very much.
What were you afraid of?
I just don't like the numbness or how it feels. I just don't really like it.
Really? So to other kids who might have to get this procedure done, what would you tell them it was like? What did it feel like?
All you really felt was just kind of like an icy feeling on your tooth, and that's really it.
Really? And I like your hair color. It's really cute. You can see the pink tips there. And Dr. Wender, how long has this new laser been out?
It's been out about a year and a half. I was the first dentist in Texas that got it. I got it on a leap of faith. I decided I wanted to try. I've stayed away from lasers because all of them in the past have either just done soft tissue and hard tissue ineffectively. The wavelength of this is specific for the tooth structure.
Yeah, and it shows us, right? You can show us right there.
Yes, I mean, I can change the settings from enamel to dentin to soft tissue just with a touch of the finger.
And show us the video. Teresa, let's see that video. And you said you can change the setting with just a touch of a finger.
There's the video up here on the screen.
And tell us what we're seeing.
We're seeing, I worked on a patient yesterday, and you're going to see the little green light in the mirror. That is my pointer light. That's not actually the laser. That's like a pointing laser. And that you'll see the white light is actually the plume from the laser. And that's ablating the tooth structure. It just kind of wipes out the tooth structure, evaporates it.
And the patient isn't screaming or squirming or anything.
No, and he loved it.
It's almost back to school time. Is there a downtime? Can kids come in? What's the age limit on this?
There is none. I mean, we've worked on 5-year-olds, 4-year-olds. There's no limit, and the beauty of it is for a child who's not numb, they don't have a numb lip or fat lip afterwards. They're not prone to biting their tongue or their lip. So that's always a problem with children. We always have to warn the parents, watch them so that they don't bite themselves. Because it's numb and they don't feel anything, they'll bite a hole in their lip or chew it.
Very interesting. How many patients have you done so far with the laser?
Oh, gosh,
dozens?
Dozens. And the beauty of it, and I don't use anesthetic anymore. I mean, I don't have to, very seldom do I use anesthetic. And it's I can do it on myself here. I just have to put on these glasses.
But that interferes a little bit with the. Thank you. That interferes a little bit with the microphone and the frequency. But yeah, he can put it right on his hand, and it doesn't even. He says it doesn't even hurt. And so this is a new way of doing things. This is a very expensive machine, so I'm not sure how many dentists will get it right away. But it's been approved by the FDA for and in use for about a year now, and even it works on kids. So we're live out here, Melissa and Tom. What do you think? You guys going to give it a try?
Well, I'm going to try to brush my teeth and avoid cavities in the future.
Well, I know what I sure am going to try to do is pick up the phone and call my dentist and say, hey, look. And I hope a lot of other people will do that too, right?
No
Get
more
one
drills,
now.
right?
Yeah.
Great
That's
idea.
a great idea. Thanks, Domily.
You're welcome.
Hey, let's talk money right now.